Good afternoon and welcome to the WAVY Digital Desk. Today we're going to be speaking about one of the top leading causes of cancer deaths, colorectal cancer. I know that many of you in the community are probably familiar with it. The American Cancer Society reports that in this year alone, 48,000 people in Virginia will have colon cancer. Now today we're going to break down some of the information that you need to know about colon cancer with a gastroenterologist from Riverside, Dr. Jamela is going to join us today, and she will talk to us about, the top tips, especially during this month, which is national, the National Awareness Month. So I'm going to bring Dr. Jamela Winter on now, and she's going to sort of walk us through what colon cancer is and what you need to know. Dr. Jamela Winter, thank you so much for joining us this afternoon.
Thank you for having me, Sarah. I really appreciate you inviting me on.
Absolutely. And for those who are not familiar with your practice, you're with Riverside Gastroenterology Specialists in Newport News. Can you just get us started by talking to us a little bit about, the patients you see and what you cover?
Absolutely. So I am a gastroenterologist. So I specialize in gastrointestinal and digestive disorders. And I do routine endoscopy and colonoscopy for patients who need routine care.
And for those patients that you see, I guess, is cancer a familiar diagnosis in terms of what you all catch in some of these tests?
Unfortunately, it is. It's very common in the community. And as you mentioned, colon cancer is now the leading cause of cancer deaths in the United States. It's actually now the leading cause in men under the age of 50 and the second leading cause of cancer death in women under the age of 50, second to breast cancer. And it's unfortunate, common diagnosis that I see frequently.
And I want to get into sort of the age and some of those screening, recommendations that have changed in just a bit. But first, can you explain what is colorectal cancer?
Sure. So basically, colon cancer is abnormal cell growth in the large intestine or the lower part of the digestive tract, right? So the large intestine compromises the colon and rectum. So the reason why we do screening modalities, which we can get into, is both a preventative tool to prevent colon cancer, but it is also diagnostic.
And in terms of what you're catching,
right,
we've heard of, precancerous spots, but then also when you catch cancer. Can you explain the difference between those?
Right. Very important question. So basically, there are precancerous lesions called polyps that commonly grow in the colon and rectum. And these lesions are benign, they're non-cancerous, but if left in the colon over decades of life, then they can turn into cancer down the road. So it's very important to do a testing like a colonoscopy where we can go in, do direct visualization, and we can actually remove the polyps in real time. So if we remove the polyps, that means that they can no longer turn into cancer down the road.
And what you're seeing on screen, if you're joining us today, are some of the examples of surgeries that we've had video from that are being shown in some of the screenings right there. I guess that is a device that you all use, correct, for colonoscopies?
That's right. Yep, that is a colonoscopy. It's basically a visualization camera that we insert into the rectum and the colon.
And in terms of who actually is at risk for this, I know that there are multiple factors, whether familial, genetic, maybe lifestyle changes. Can you sort of break some of those down for us?
Absolutely. So about 50% of cases are attributed to an identifiable risk factor. And those risk factors include obesity, so being overweight, being physically inactive or living a sedentary lifestyle, having a diet that's high in red meats, processed foods, sugars, and smoking tobacco. And lastly, having a high consumption of alcohol.
So some of those things obviously are within the patient's, I guess, everyday life to sort of decide to change those behaviors.
Absolutely. So, patients will come in and say, doc, what can I do to at least minimize my risk of potentially getting colon cancer down the road? And I would say, working on those risk factors, right? Eliminating the amount of alcohol that you consume, eliminating tobacco use, being physically active, being within a healthy weight range, for example, and then having a diet that's high in fiber, that's high in fruits and veggies. I will also say that family history plays an important piece of one's risk of colon cancer. Unfortunately, having a first degree relative with a history of colon cancer does increase one's risk significantly. So, the recommendation to get a screening like a colonoscopy is actually lower for those who do have a family history.
That's interesting. So, in terms of knowing your family history, that is really important in understanding your risk.
Absolutely, absolutely. Make sure you're having those conversations with your family members.
And, for me and for people that, are paying attention, obviously, to things coming down, I feel like colon cancer is a part of, the conversation. But it is one of those things that I feel people don't talk about as much. Do you think that is due to stigma? Do you think people don't understand how, I guess, poor, the signs are? I mean, I guess I'm just trying to break down what is it, because it is up there with breast cancer, which is so talked about. What is it?
I do think there's a lot of stigma around kind of colon cancer and just talking about colon health in general. And that primarily is because of the fear of the unknown. A lot of people aren't aware of what a colonoscopy is, what that entails. They think it's a surgery, but it's actually a very minimally invasive procedure that's very well tolerated and usually done under anesthesia. So a lot of patients don't feel any discomfort with this procedure. And I think a second piece also is people are not aware of the signs and symptoms that should be raising a red flag for them. And those include having rectal bleeding, weight loss, abdominal pain, changes in bowel habits. These are all reasons to get evaluated and potentially getting a colonoscopy.
And I know that people always talk about the prep, and I just sort of wanted to give a full picture on screen of some of these procedures for a minute. But when they talk about the prep, I mean, and they are nervous about it, or that's something that really makes them not want to get a colonoscopy, what are the things you tell them about how important that procedure is?
Right. So, again, this is a direct visualization type of procedure. We need to go in and see the entire colon, right, without any obscure debris or retained stool. So, it's very, very important to clean out. So, the most important part about the colonoscopy is the colon cleanse. And a lot of people I think they have a kind of a misconception of what that entails. And it really is just one day of taking a laxative to clean you out. And it doesn't take a lot of preparation, and it's very well tolerated. And we often give medications for patients to help them be able to tolerate these laxatives.
And I just want to repeat a stat that I gave at the beginning for anyone joining us. 48,000 people in Virginia are going to be diagnosed, according to the American Cancer Society, this year with colon cancer. To me, that is a staggering number. And it sort of makes me think, are those people that are getting diagnosed from, early on? What we've heard is that people don't necessarily get diagnosed that early. Sometimes it is later stages.
Right. Yeah, I think there are multiple components to this. I would say that usually in the older population, we are diagnosing them at time of their first colonoscopy because they're getting them too late, right? Our guidelines have now recommended and now have changed for us to get screening at age 45 years old. And a lot of people in the community still think it's age 50, or they're coming to see me at 60 years old and they're getting their screening, and that is far too late. And at that point, a lot of patients, unfortunately, will have that diagnosis of colon cancer. But I think a second piece is the younger generation coming in and now being diagnosed with colon cancer at such a young age, and unfortunately, usually at a very late stage. And I think that's because younger folks think they're immune to having cancer and they think these issues may be benign. For example, I see a lot of patients who have rectal bleeding and they'll say, this is from hemorrhoids or constipation. I'm a big advocate for if there's something different in your body to get evaluated.
And when is the right time to bring up to your doctor those familial history, disorders that you may have? When's the right time to sort of connect on that?
As soon as possible, as the first introduction in your adult life to a medical professional, particularly your primary care doctor or general practitioner, that is a conversation that needs to be had. They should know your family history, your personal history, as soon as you make that first introduction to your general practitioner.
And just to jump back at something you just said, with showing bleeding, that is a more visual sign. But,
Right.
catching those earlier signs reportedly is difficult, to catch sort of what's going on in your body. If you're in that category maybe where you don't have familial history, but you
Right.
do end up with colon cancer, I mean, if the age is getting younger, I'm just curious, what should people do to sort of keep an eye on that if they're under that screening age?
Right, that's a great question. So the subtle changes, I would say, stomach pains probably are, the second largest cause of patients seeking care for, a GI specialist. So if you're having stomach pains or a change in your bowel habits that is not normal for you, right? If you're starting to feel like you have a blockage, constipation, or even feeling like you're having more loose stools or diarrhea, that's not typical for you. These are other subtle signs for people to, be concerned about and ask their doctors if there's something going on.
And I know that we're talking about it very openly here, but do you think part of the problem, again, to go back to the stigma, is people don't want to talk about their bathroom habits and people don't want to talk about their day to day?
Yes, that's absolutely right. A lot of people, there's a big stigma about talking about your poop. And, I think when I see patients in my clinic, I try to normalize that conversation, right? It's just like you talk about sleep habits and mental health. Talking about your bowel habits and your urinary habits, for example, is a part of the medical process, right? It's very normal. And so I try my best to normalize that as best as I can in conversations with my patients.
And some of the time, right now, there has been reports, I shouldn't say some of the time, a lot of the time, since about 2017, I've seen the pickup of articles just before researching for this conversation, but the younger cancers are becoming more prevalent. It really seems on all sides. Is it something that you all are worried about in terms of screening right now? The age is not till it says 45 really is the recommendation. I mean, would you hope that this becomes a little bit more routine for people even maybe in their 30s?
It is. And, I would not be surprised if our governing bodies who basically create these guidelines move the age to even lower than 45 in the coming years because of the staggering numbers that we're seeing. Obviously, we need more data to basically support us moving the timeline to a lower age. But I hope with conversations like this, patients will be more aware of the symptoms and signs that are abnormal and important for them to seek care.
Absolutely. And I wanted to ask you too, just today, the AP came out saying a blood test for colon cancer performed well in a study. It was just published yesterday. But it's saying that it's catching 83% of cancers, but it's not catching those precancerous growths, which I
Right.
think is really interesting. And from what you said earlier in the conversation, those are really key in diagnosing early and getting ahead of it.
Right. This is like hot off the press. I'm so happy you asked that question. So the reason why the colonoscopy is the gold standard for colon cancer screening because it's the perfect screening test, right? It helps prevent colon cancer and also diagnose it, and that's the key. And that's the difference between colonoscopy and stool-based or blood-based testing, right? And so stool-based and blood-based testing can help kind of pinpoint, oh, there might be a cancer in the body. But a colonoscopy in particular helps to identify non-cancerous or precancerous lesions that we can remove at time of the exam to help prevent colon cancer in the future.
So, I mean, people, while it should be exciting, that there is a development and there is developments in the field, it's not a replacement.
Absolutely. No, it's not a replacement. It's an adjunct, right? It helps to support the diagnosis of colon cancer, but in no means should it replace a screening tool like the colonoscopy.
And just for anyone listening, just to say, it's not been approved by the FDA yet, but it is available for sale in the US, and it is, most insurers aren't covering it currently. So we'll see, how that develops. But yeah, that's spurring up yesterday really as a headline. And I just wanted to break it down. So that's so interesting, that adjunct, not a replacement. The other thing I did want to ask about too is, and this is a little bit of a offshoot, but celebrities having cancer, or people that sort of are able to grow that awareness, that's been a big topic recently. And even just this week, a celebrity spoke about her battle with breast cancer and not having any underlying conditions, having no sort of risk factors, so she thought. And then a risk assessment exam was able to then catch her breast cancer, basically, and her doctor was able to order an MRI. I know that may be more singular case, but in case of, being at risk for colon cancer, when it does hit those later stages, and it is, I'm sure, harder to treat, what is that like coming into the office with you and sort of looking at what risk factors are? Are you asking patients, a bunch of questions to sort of talk about maybe whether they possibly might need to be screened earlier? I guess I'm just curious, when someone walks in your office, what's that conversation like?
Right, exactly. So, I'm going to be honest with you, there's a lot that's still unknown about the cancer disease process, in particular colon cancer, right? There are patients that I have that are healthy, that are young, that don't have these identifiable risk factors, who have very advanced polyps or a new diagnosis of colon cancer. And it's really hard having those conversations with these patients, because they're always like, what did I do wrong? Or what is it about my lifestyle or my family history that put me at risk? And, unfortunately, it's just having a conversation about, we're not entirely sure, but in terms of moving forward, these are the healthy habits that you should institute or continue to help preventing other types of cancers or recurrence.
And that's interesting. I mean, there is so much unknown in the world of cancer. I guess why awareness months are so important, to get that funding for research, I imagine, and just awareness for people to notice little changes in their body.
Absolutely. I'm wearing my blue today because March is colon cancer awareness month. So it's a very important topic to have every day of the year, but in particular this month.
Absolutely. And do you think too, and I just want to say, it's one of the leading causes of cancer, especially in men.
Yeah.
That conversation about men's health, and I think, at least in traditional sense, men sort of might shy away from some of these things and try to be stronger, I think. And I don't want to speak for the whole population, but in general, that is what we've heard, from certain people. How do you break that down with your patients, if men are coming in to talk about some of these things, and to maybe, go back to their group of friends or their family and sort of spread that knowledge?
Absolutely. I always talk to my male patients and say, look, you're because of your male gender, you are at risk for colon cancer and for other kind of gastrointestinal disorders. And that just means that it's particularly important for you to pay attention to your body and to get your routine checkup and to have these conversations with your primary care or general practitioner. But most importantly, sharing your family history and your health diagnosis with close family members, and particularly with your children as well, because it impacts their health as well.
And Dr. Winter, thank you so much for sort of outlining, a lot during this conversation in terms of the risk factors, what it is, how the screening process works, and so much. I guess one of the last questions I want to pose to you is there anything new coming down the line, or things that you're looking at?
Yeah, I think we are trying to understand a little bit more about the genetic component, right? And so we do know having a family history is important, or plays a big piece in colon cancer. We're not entirely sure all of those linkages, and what that entirely means. So I do think there's more research to be done on the genetic component of development of colon cancer.
And one thing that just reminded me of that we didn't get to today, but there is a disparity in the community about who actually is diagnosed early, screenings, who is diagnosed more. And, it is on those lines of ethnic and racial lines. I mean, how do you feel about that in the community?
Thank you so much for that question. It's so important. So that's right. Especially the African American population and American Indian population are at highest risk of colon cancer. But not only that, but when they do present with colon cancer, they tend to be at a later stage. I think there are multiple factors that go into that. I think one of the most important, unfortunately, is access and having access to healthcare and healthcare providers. I do think there is a component of, again, the unknown and unfair of a screening modality like colonoscopy. And lastly, I know there's some cultural kind of mistrust between some communities of color and the healthcare system. So these are conversations I'm also having with my Black and brown patients in the office setting.
And is there any encouragement you give them in terms of, being open with you or being open with their doctor on any sense?
Absolutely. And so I give them the numbers. I said, you're this community, you guys are at double the risk of getting colon cancer. And, you're doing this not only for you, but generations to come. And it's important for your children, your grandchildren to not only take care of yourself, but to know your risk and to know your health status for their kind of wellness as well.
Right. And while it might not be exactly the conversation you want to have at the dinner table or,
Right.
in every day, it is so important. And I guess it's led by example in every, family or friend group.
Absolutely.
Well, Dr. Winter, thank you again. I mean, I just want to give you the floor. Is there anything else that you want to share before we sign off, whether to the community or just about this month in general?
Well, yeah. So this is March Colon Cancer Awareness Month, and I want everyone who's watching to know that our screening guidelines suggest that you need to get screened at age 45 years old if you're an average risk individual, meaning no family history of colon cancer and no symptoms. It's 45, no longer 50. But most importantly, if you're having symptoms of rectal bleeding, pain, weight loss, please get evaluated and talk to your healthcare provider about potentially getting a colonoscopy.
Well, Dr. Winter, thank you so much. I mean, it's such an important conversation to have, and I hope, through this and through this longer conversation, people are able to share it and share certain things that you shared, from advice to screening, to risk factors, to having this conversation, and to understanding their risk, which I feel like is such an important piece of this and sort of communicating that. But thank you so much again.
Thank you so much, Sarah, for having me on today.
Absolutely. And for anyone joining, please head over to wavy.com. If you're on Facebook or YouTube, it's linked. If you're watching on wavy.com, that's great. There's resources to go back to Riverside, the American Cancer Society, as well as the CDC to learn more and to look at more resources online. Thank you for joining us.